Hello, this is Akram Jafar, and in this session I'm going to deal with the lymphatic drainage of the thorax. Now let's deal with lymph nodes of the chest wall. These are in three main groups, either parasternal nodes that are located at the anterior end of the intercostal space along the internal thoracic artery, and they drain the medial side of the breast, which can also drain to the abdomen and to the contralateral breast. The second group of lymph nodes in the chest wall are the intercostal nodes, and these are located at the posterior end of the intercostal spaces. And then the other group are called diaphragmatic nodes. They are located on the superior surface of the diaphragm. We mentioned these diaphragmatic nodes or phrenic nodes when we dealt with the liver, and we said that they also drain the bare area of the liver. And they are also connected to lymph node groups that are located on the undersurface of the diaphragm and the wall of the abdomen. The second group of lymph nodes that are present in the chest are the mediastinal nodes, and these are subdivided into posterior mediastinal nodes that are located behind the pericardium, and they drain the esophagus and the posterior part of the pericardium. And then we have the anterior mediastinal lymph nodes, which are also called brachiocephalic lymph nodes because they lie in front of the brachiocephalic veins, and they drain the thymus. They also drain from the thyroid in the neck because lymphatics will follow the inferior thyroid veins, and they drain the anterior part of the pericardium. The efferents from these lymph nodes will go to the bronchomediastinal lymph trunk, one of the three lymph trunks that join either the thoracic duct on the left side or the right lymph duct on the right side. Then we have lymph nodes around the divisions of the trachea, and these are either pulmonary lymph nodes, which are located in the lung tissue itself, or the other group is called the bronchopulmonary lymph nodes, and these are located at the hilum of the lung, the region of the lung where structures pass in and out of the lung. The main structures there are main bronchus, a pulmonary vein, and a pulmonary artery. But in addition to that, there are lymphatic vessels, and there are also lymph nodes. You can see them here. These lymph nodes, as well as the ones that we have just mentioned about the abdomen, they cannot be palpated like the axillary or the cervical or the lymph nodes in the groin, but they can be detected. Like, for example, here you can see this is a CT showing enlargement of hilar lymph nodes as well as mediastinal lymph nodes. These are posterior mediastinal lymph nodes. Remember, here we have posterior mediastinal lymph nodes, which are located behind the heart. So these are posterior mediastinal. These are the hilar lymph nodes at the hilum of the lung. When these lymph nodes are enlarged, they might produce some complications. So, for example, here let's take this case as an example of enlargement of hilar lymph nodes. Of course, they will cast a shadow even on a plain X-ray of the chest. A 34-year-old man presented with hoarseness of voice and non-productive cough of 3 months duration. Laryngoscopy revealed paralysis of the left vocal cords with no lesion in the larynx. So he has hoarseness and cough, but there is no problem in the larynx. Physical examination showed no other abnormal finding. When a chest radiography was done and computed tomography, like the one that we have seen here, of the thorax, demonstrated enlarged mediastinal and bilateral hilar lymph nodes. So a biopsy was performed by doing what we call a mediastinostomy, and this confirmed the diagnosis of sarcoidosis, which resulted in enlargement of multiple lymph nodes. Therefore, because these lymph nodes were enlarged, the cause of hoarseness was attributed to a nerve compression. The question here, which nerve was compressed? So we can just imagine that the hilar lymph nodes are located here in this region among the pulmonary veins, pulmonary artery, and the main bronchus. And on this side, the left side, there is also the vagus nerve. The vagus nerve, the left vagus nerve, in the superior mediastinum will give rise to the recurrent laryngeal nerve that will recur up, go back to the larynx, and it supplies the motor innervation of the muscles of the larynx. So when this nerve is compressed here, because of enlargement of the hilar lymph nodes, this results in hoarseness of the voice. This does not happen on the right side because the left recurrent laryngeal nerve does not reach the level of the hilum of the lung. It recurs around the right subclavian artery. So that's why this is only seen on the left side. Okay, of course, and this is, I mean, the main, the actual reason is embryological and evolutionary reason. What other nerve compression could take place in this case? We can see that there is another nerve which is related to the hilum of the lung. In fact, the vagus nerve passes behind the hilum of the lung, but in front of the hilum of the lung, we have another nerve also descending down from the neck, and this could happen on either side of the body. This is the phrenic nerve. The phrenic nerve, which has the root value of C3, 4, and 5, mainly C4. It is the motor supply of the diaphragm and might also get compressed when hilar lymph nodes are enlarged because of its close proximity to these lymph nodes. On this diagram, and this is viewed from behind, posteriorly. So this is the esophagus. In front of it is the trachea and the bifurcation, and in front of it is the arch of the aorta. And you can see here that on the left side, the left recurrent laryngeal nerve, look at the close proximity of the left recurrent laryngeal nerve to the hilar lymph nodes. No such left recurrent laryngeal nerve is located on the right side at this level because it recurs higher up at the root of the neck. Now, the other lymph nodes, apart from the pulmonary and the bronchopulmonary lymph nodes, we have the tracheobronchial lymph nodes. These are located around the division of the trachea. Also, we have the paratracheal lymph nodes, as the name indicates, on either side and in front of the trachea. And efferents from these, they will again go to the bronchomediastinal lymph trunks. Here, the tracheobronchial lymph nodes around the division of the trachea can be further subdivided into a superior tracheobronchial and inferior tracheobronchial lymph nodes. We are here more concerned about the inferior tracheobronchial lymph nodes because enlargement of these lymph nodes can be detected through a bronchoscope. They are actually located outside the trachea, just below the region of the bifurcation, which is called the carina. And the carina, as you can see it here from inside of the trachea, this is the normal carina. It's a bit sharp projection at the site of the bifurcation into two bronchi. But when the lymph nodes that are located beneath the carina, they enlarge, you can see that the carina here becomes like blunt and wide, which indicates that there is an enlargement of structures just beneath it. Now, this is to show you the plan of the lymphatic drainage of the thorax, a wrap-up. So we have either lymph nodes that are related to the thoracic wall, parasternal anteriorly, intercostal at the posterior end of the intercostal space, and we have the diaphragmatic or the phrenic nodes on the superior surface of the diaphragm. In addition to that, we have the mediastinal nodes, and these could be anterior mediastinal, which are also called brachiocephalic along the brachiocephalic veins, and we have posterior mediastinal, which are located behind the heart, and we have lymph nodes that are related to the lung and the bronchial tree.
So we have the pulmonary, we have the bronchopulmonary, we have the tracheobronchial, we have the paratracheal lymph nodes. And as you can see that all of these, they drain to a bronchomediastinal lymph trunk. Some of them, they drain directly to the thoracic duct, but most of them, they drain to the bronchomediastinal lymph trunk, which is going to join the subclavian lymph trunk from the upper limb, the jugular lymph trunk from the head and neck, and will ultimately drain on the left side to the thoracic duct and on the right side to the right lymph ducts. Now I'm going to deal with the lymphatic drainage of the head and neck.